Today on Be More Lifestyle, things to know about dental health, plus nail your nude lip color.
Be More Lifestyle. Now, here are your hosts, Brandi Proctor and Candace Gold.
Hi, everybody, and happy Monday. I'm Brandi Proctor. Welcome to Be More Lifestyle. We are kicking off your week with tips to find the perfect nude lip and tips to make your next tailgate party a smash.
And speaking of snacks, let's get started with some dental health.
This segment is sponsored by the Center of Dentistry.
Today we're talking with Maryland's leaders in dental care, the Center of Dentistry. Now joining us to share more about their high quality care is Dr. Michael Rosen. Welcome.
Thank you for having me.
Thank you for being here. So tell us more about your practice and how long you guys have been serving the community.
Sure. So I graduated from the University of Maryland Dental School in 2013.
Okay.
So believe it or not, I've actually been practicing for 6 years. And I opened a practice about 1.5 years ago in Timonium, right in the corner of York and Seminary. And I love being able to own my own practice and be able to give the best treatment that I can at an affordable price and also keeping people as comfortable as possible.
Right. Well, congratulations.
Thank you.
And so, okay, it looks like you brought some fun things, but tell us, you see patients with a lot of different needs, right? But those that don't know, tell us about some of the basics of dental health.
Sure. So I think the things that are important to realize as far as dental decay or dental problems is that there are a lot of things containing sugar that we don't realize, or especially the amount of sugar that's in some of the products that we're packing for our kids' lunches or we're all consuming on a regular basis. I also think our own oral health and hygiene practices at home as far as brushing our teeth regularly, and really most importantly is really seeing a dentist on a regular basis. I think we're all guilty of being very busy in our lives, and we kind of sometimes are always focusing on our kids and we forget about ourselves. So the importance of really seeing a dentist every 6 months to really detect any changes in enamel and come up with the best treatment options that dentistry has to offer.
Right. Okay. So I see a whole lot of things here on the table. So when talking about sugar, are there foods that we don't even know actually have sugar in them?
I think there definitely are. And the thing with sugar is that I think it's something that it's not always so much the amount of sugar, but more importantly, the frequency. So I have patients all the time, they tell me that I only have 1 can of soda a day. What they don't realize is that by sipping on that 1 can all day, it's actually worse for your teeth sometimes than consuming it all just with 1 meal, for example.
Okay.
Some of the products that I have on the table here, just to kind of outline, is my kids love these little Danables, for example.
Mine too.
And there's 9 grams of sugar in even the smallest little thing of yogurt. And as we kind of work our way across just the different items as far as how much sugar they really have. These little cereal bars have 16 grams of sugar, Cliff bars 21 grams, little thing of juice 32 grams of sugar. The American Heart Association recommends we not exceed any more than 37.5 grams of sugar for men, 25 grams of sugar for women.
Wow.
And these products, just by consuming a little thing of juice, that's pretty much your whole daily intake of sugar that you're supposed to have for a day. What I think is most surprising is the little thing of Mountain Dew has that much sugar in it, which is just unbelievable.
Right. And so we see all of this soda. Okay, what about alcohol? Tell me something good.
So I think the big thing with alcohol, I'm not going to sit here and tell people don't consume sugar or don't drink alcohol. I think the big thing to realize, though, is that a lot of us have the tendency is, we'll be out, we'll have some wine with dinner, we'll have a beer, and there is a lot of sugar and, more importantly, the acidity in wines that's actually even worse for your teeth. And the worst thing you can do is drink that and then go to sleep without brushing your teeth, and that's what really can cause some dental problems.
And so explain to us what actually happens. So the sugar and the acidity, what causes cavities to form?
Sure. So there's actually a lot of bacteria in our mouth that's normal, and what happens is when we consume sugar, the bacteria actually feeds on that sugar and produces acid, and that's what actually breaks down the enamel of your teeth. So the important thing is not only trying to limit your sugar, your amount and frequency, but most importantly is going to a dentist for routine checkups to make sure that cavities aren't forming, and if they are, to be able to treat them as quick as possible before it leads to even worse dental problems. In my office, for example, we have all the latest equipment and technology to detect even the smallest changes in the enamel, and the most important thing is the prevention, but if a cavity already exists, we want to get on top of it, not only find it, but treat it before it really causes a problem.
right? Okay, so a little discouraging for me with the Danimals, but okay, so let's say that we know our kids are going to come in contact with it, right? How do we manage their dental care, our dental care around eating some of the bad stuff?
Sure. You know, and the funny thing is people always say to me, oh, you're a dentist, you probably never drink or eat anything with sugar, or you don't let your kids have it. And truthfully, I have a sweet tooth myself from time to time, and I'm not going to tell people don't ever consume sugar, but the important thing, I think, is to realize that, you know, how much sugar are we consuming, how frequent are we doing it, and most importantly is, are we taking care of our teeth and seeing a dentist? Making sure you really need to be brushing your teeth and your kids' teeth every morning, every night before you go to sleep, especially if we are consuming things with sugar, or drinking a lot of alcohol or beers that, you know, have sugar content, and then not brushing our teeth after is not good. And also making sure you're really seeing a dentist, not only to come up with good prevention techniques, but more importantly to really detect if there is any problem and then talk about some treatment options.
So you just touched on my next question. How do you know if there's a problem?
Sure. So people ask me all the time is, you know, do cavities always hurt, you know, or am I going to know if I have a problem? And the answer is no. There's a lot of times that dental issues go undetected or untreated because people think that, oh, I don't have any pain, so how can I have any dental problems? As I was saying, in my office, for example, we have a lot of equipment and technology to not only detect even the smallest changes in enamel, but more importantly, to realize that if there is a problem that you're not aware of, to not only bring that to your attention, but talk to you about how it is that we're going to fix it comfortably and most importantly, I'd say as affordable as possible as well.
All right, it sounds great. You sold me. Tell everybody where to go if we want to come see you.
Sure. So my practice is called the Center of Dentistry. We're located in Timonium, right on the corner of York and Seminary, exit 26 off the Baltimore Beltway. We're a new office. We have all the modern equipment and technology, and I really pride myself on making people as comfortable as possible. I think one of the biggest barriers to people coming to see a dentist is they're scared. They might have had a bad experience before. They're worried about pain. I pride myself on really keeping people as comfortable as possible, discussing with them exactly what we're going to do before we do it, talk them through what it is that we're doing, keep them as comfortable as we can, and I try to kind of knock down as many of those barriers as I can. I think another big barrier to people coming in is the cost factor. A lot of people are definitely concerned about, you know, dentistry does come with a high price tag, but truthfully, I think that the important thing is to realize the value of dentistry is that there are a lot of links between our dental health and our overall health and well-being, and I think it's important to realize that sometimes it's definitely well worth it taking care of ourselves and our dental health. In my office in particular, we have a discount plan for patients that don't have dental insurance to be able to try to make it a little more affordable compared to the usual and customary rates in the area. I also have a new patient special that I'm willing to offer anyone that sees me on the show today. If they mention Baltimore Lifestyles, for $99, we'll do a full exam, cleaning, and a set of x-rays.
Okay, well, I love it. Now, you heard it here first. We had all the information right there on the bottom of the screen. Thank you so much for joining us today, and we hope you guys check them out. Dr. Rosen, thank you.
Thank you.